welcome back to another episode of What It Takes, guys. I know we haven't done a What It Takes in a minute, but we're back. So in today's episode, guys, I'm talking to my friend Brad Wilson, and we're going to expose ourselves. We're going to expose our numbers. How well did we do during AEP? And I'm going to tell you guys exactly how I was able to achieve my numbers, and I'm going to also talk about how Brad was able to achieve his numbers as well. So you definitely don't want to miss this episode of What It Takes. Hi guys, welcome back to the channel. I have my friend here, Bradley.
Hi guys.
So anyway, so Bradley is a Medicare agent, broker as well.
Absolutely, yeah. I'm the owner of Iowa Senior Advisors.
Yes. So he's been on my channel once before.
Absolutely. I met my friend Patricia at the Six-Figure Medicare Summit last summer.
Yeah.
And I'm glad I met her. She's an awesome agent, and we learned a lot from each other. So. Yeah.
Yep. So anyway, so we thought about just turning on the camera and just having a conversation about AEP. So we're gonna basically expose ourselves.
On camera.
Alright, so we're going to expose ourselves. We're going to expose how we did and all of that good stuff. And we're going to talk about our goals.
Absolutely.
Because it's 2023. Like, we need to, like, step it up a notch, you know?
Everybody's setting goals now, whether it be fitness or business or, you know, just in general life. You know, what do you want your life to be in the next year? And we're doing that as well.
Yeah, exactly. I know one of my main goals is to start calling my Medicare leads. I kind of talked about it before in a vlog or whatever, but yeah, I do need to call my Medicare leads because I literally purchased a course, learned how to do Facebook ads. The leads are coming in, but I ain't calling them.
Let me tell you what, guys. I just stopped in here to visit today, and I sat down next to Patricia, and I was like, Patricia, why don't we call these leads? Within 2 minutes, she has somebody on the line who's like totally interested, who's ready to buy as soon as they get approved for Medicaid. And they already applied for Medicaid 2 weeks ago. I mean, this girl is really good, so you definitely have a future at it.
Thank you.
At calling leads as well as all the other things you do. So.
Yeah, thank you. But yeah, I need to call my leads for sure because it felt really good, especially since I created the lead myself, and to see it actually worked.
And here's the thing, guys, too, is the lead has like Patricia's beautiful picture on it, and it texts them a text message every time they respond on Facebook. I mean, you did a great job on that because like he was expecting your call. Like it wasn't like you were a telemarketer just out of the blue calling him. You know, he saw your picture. Maybe he went to your website and everything already, so he knew who you were.
Yeah, that was real cool. So yeah, so that's definitely my first goal. Call my leads. And I want to hire somebody. I definitely need help. So what's your goal for 2023?
So my goal for 2023 is to change my business from a business that I've just had basically one business model for 2 years. It's worked really well, but it's not going to be sustainable long term for a couple of reasons. My business model has been to buy direct mail leads and go see them, or even just sometimes I would call them over the phone and sell them, but mainly I would just go see them. And sell them. And my goal for 2023 is to expand into other lead sources. So I want to be able to utilize Facebook and all the other digital platforms to generate leads and also use funnels and those types of things, and maybe even do seminars as well. It's going to be a learning process, but I'm pretty confident I'm going to do it. Yeah.
Awesome. That's awesome. All right. So do you have a question for me?
Yeah.
Or not yet?
I think you do definitely hit it hard on several fronts in digital marketing, but you're really big in social media, and I've admired what you've accomplished in YouTube and a lot of different social media platforms as far as educating the public on all the benefits of Medicare and helping people understand how things work better. What are your goals for your YouTube channel in 2023?
Oh, that's a good one. Okay, so my goal originally for Life and Med, talking about Life and Med?
Yeah.
Okay, so for the Life and Med, which is my business YouTube channel, was to get to 1,000 subscribers. and I'm at 925.
Awesome!
So I just need 75 more.
I just talked to her about this like a few days ago. It was like 800 and some, and so you already added like 30 people in a few days. So you're doing great.
So basically with the Life and Meg, YouTube Shorts is like so popular right now.
Yeah.
Like it's a really great way to get in front of people because like YouTube is like rewarding people to do the YouTube Shorts. So that's how I've been growing my channel really with the YouTube Shorts. It's quick, easy. What I do, I pick a topic that is people want to know, but the information is not out there yet.
And then,
so I use that topic to like build my audience right now. Whether it's disability, like something that's outside of the norm that a Medicare broker will talk about. Disability. I don't want to share all my secrets. You can go to my channel and find out what I've been talking
subscribe.
About. Exactly. So yeah, that's. What about you for social media?
So for social media, one of my goals is to develop a YouTube presence in 2023, and I want to do it for Medicare and then just potentially even Obamacare as well.
Yeah, definitely.
Yeah.
All right, so are you ready to expose ourselves for AEP? How do we do?
Let's go.
All right, so let's talk about the. Okay, so my Medicare numbers sucked. Okay, they sucked. But this guy Medicare numbers was bomb. Like, so go ahead and, shine,
I sold 117
during AEP.
AEP, yeah.
That was awesome.
Yeah. But like I said, it was really grueling. I mean, some days I would drive, 2 hours to get to my appointments, run them 7 appointments and drive 2 hours and come home. So, and in between I'd have to answer follow-up calls and stuff like that. So it's pretty tough. So it's, but I did do pretty well, numbers-wise.
You said 117?
Yeah.
All right, guys. So you guys heard it right. Mr. Brad, he was able to gain 117 brand new Medicare clients. So let's break down how was he able to achieve that goal. So number one, he already had a system in place and he continued on with that system. And that system is that where he purchased direct mail leads in his community, okay? So Brad lives in Iowa and there's not a lot of agents in Iowa. So that is a great opportunity for him to, present to his community. So what he does is he buys direct mail, and once he gets that direct mail, he sends that over to an individual that calls his leads. Yes, that's right. He has a lead caller. What is that the proper term? What do you call them when they call your leads? What is that term? It's called a dollar. I think it's called a dollar, right? So basically, this individual, that's her business. She calls leads and she books your appointments, okay? So she books your appointments, so you're not doing any dialing whatsoever. You're not calling anybody, right? So basically, she sets his schedule and sends it over to him, and then all he has to do is drive to his appointments and close the deal. So basically, how he has it set up is that all of the scheduling in one particular area would be scheduled on that day or that morning or whatever that is. Sometimes he actually has to stay at a hotel if the appointment is like 2 hours away, like he said in the video. So that's how he was able to successfully do well during AEP. Like I said, he had a dollar. He purchased direct mail leads in his community, and he went to the appointment and closed the deal. So that's how he was able to do well during this AEP. So he get the shine with his Medicare. Can I shine with my Obamacare?
Do it.
So I did really well with Obamacare. Not so good with the Medicare, but I did really well with Obamacare.
Yeah, you did very well.
And with Obamacare, I'm looking at least 300 acts.
That's incredible. Yeah, you are doing so well. I admire a lot how you've developed systems in place and organization-wise to be able to accomplish everything that you're accomplishing and provide excellent customer service to these people and really help a lot of people. There's a lot of people, I'm sure, Patricia, that have been going to like a free clinic because they didn't have insurance. They didn't know that they qualified due to the new laws and stuff. you were able to reach out to them and help them find a plan and help them get covered so that now they can go to the same hospital everybody else goes to.
Yeah.
And you know, a lot of these people are people that are working really hard. Maybe they're working at McDonald's right now or something, you know, along those lines. And they're busting their butt every day, paying taxes, and they deserve some good coverage, and you helping them get it. So
yeah, definitely. Awesome. Obamacare is awesome. I'm sorry, I don't care what nobody say. But yeah, I mean, the only thing that I don't like about Obamacare is that their income is too low.
Oh yeah.
Like the income requirements to get like the $0 plans or a $20 plan or even a $30 plan. It's just the income requirement is just.
Yeah. Like for example, I just recently signed up for a plan, and I don't make a lot of money, but they said that I had to pay.
Stop lying.
For a plan, it was like, and I mean that's a lot, but like I thought to myself, well, it's either that or if I get in some sort of something happens and I get sick and I have $100,000 bill, so I'd rather have the plan. But yeah.
And for me, I also had a head start as well. So what does that mean, Patricia? So with Obamacare, there is a special enrollment period going on right now where you can enroll low-income individuals all year round. So I had started my whole Obamacare strategy 1 month prior to AEP, okay? So I already had the ball going. I had pivot, and I had pivot fast, okay? So that's how I was able to go ahead and enroll 300 Obamacare clients during this period. Now let's talk about, okay, so how did you get these leads, okay? So we did Facebook marketing, social media ads, and such, okay? And another thing I did that a lot of people don't do, but I actually do, and I thought it was my idea, but clearly it was not my idea. After working hours, I had an independent agent that I was working with, and we would go where the low-income people hanged at. Yes, we did, guys. So let me give you guys some examples where you could go ahead and help people enroll in Obamacare, because let me tell you, you have to know where your clients, I say this all the time, you need to know your demographics. Where are they? Who are you trying to reach? And I already know mine is the low income community. I already know that, right? So we strategize, okay, where do we go? Where do we go? Where are they hanging at? Because not all individuals are on social media, okay? Not everybody's on Facebook, YouTube, or anything like that. Especially if you're low income, you may not even have a smartphone or internet, okay? So we decided to go out in the community after hours, on the weekends, and enroll people in Obamacare. Yes, we did. So let me give you guys some examples. So you could go to the library, you could go to the flea markets, you can go to community centers, you can go to shopping centers. Yes, we went to shopping centers. Think about where people make lower income, they're working and they're not getting health insurance. They don't even know Obamacare exists. You have to go and present it to them. Okay, so we have McDonald's, we have Subway, we have restaurants, we have nail salons. There are so many places where you could go and go in there, talk to the owner, let them know that you are an independent insurance broker and you want to help their employees you want to help their employees get health insurance. And it's usually going to be $0 a month if they meet this certain income threshold. I mean, who wouldn't want that? Okay, so we did that, and it was crazy because we would go and they were like, oh yeah, we already signed up with X, Y, and Z insurance agency. We were like, what? We thought this was our idea. Clearly not. There are agents actually out there hustling like that out in the community, and if you don't do it, then other people will be more than happy to do it, okay? Putting out, you know, tabletop booths and things like that. So we did a lot of that as well. So that's how I was able to get my numbers to 300 new Obamacare clients. So guys, you don't always have to spend money to generate business. It's either money or your time. I do a little bit of both, but yeah, that's how I was able to grow my book to 300 ACA clients. And thank you, Obamacare. Alrighty, so we're at So we're at like 9 minutes. Anything else you want to talk about? Like, what? Do you have any other questions for me? Like,
yeah.
What?
Do you have any personal goals that you can share?
Personal goals?
For 2023?
Oh, I want to lose some weight. Family, like, spend more time with my kids. That's it, really. I don't really have anything.
That's awesome. Yeah, you do a lot as a mom. Like, I don't know if you guys realize how amazing mom you are. And yeah.
Thank you.
And so one of my goals is that I ran my fastest marathon time last year, and it was 4 hours and 19 minutes, but I want to run a faster one in 2023. So
wow.
That's a big goal of mine.
That's awesome.
Thank you.
Anything else that we share? That's it. We're done?
We're done.
All
Until
right.
next time.
Alrighty, guys. Thank you so much for watching. We just exposed ourselves, so we'll see you guys. Well, I'll see you guys on the next video. Brad don't have any YouTube or anything, right?
No, I don't right now.
Yeah.
But look, if we do this video next year, at this time I will.
Okay. Sounds good. All right. Thank you, guys. Bye. Alrighty, guys, that is the end of this video. I hope you guys enjoyed this episode of What It Takes, guys. Thank you so much for watching, and I'll see you, yes you, on the next video. Bye, guys. Ciao for now. If you like this video, maybe you should check out these 2 other videos. Thank you so much for watching, you guys. I love you guys so much. Peace, love, and always God bless. Bye, guys. Ciao for now.